Good morning to our lupus and fibromyalgia friends. Welcome to our Community Connect. Actually, it's good morning and good afternoon. We're going to switch up introductions here. I'm going to let Estella go first. So Estella, why don't you introduce yourself?
Yes, good morning, everyone. I am Estela Mata. I'm one of the co-founders of Looms for Lupus, a nonprofit organization that was founded by my sisters and I to support those living with lupus and overlapping conditions such as fibromyalgia, their loved ones, and caregivers.
Good morning, and I'm Juana Mata. I am also a co-founder for Looms for Lupus, and I was diagnosed with lupus in 2009.
And I'm Melissa Talwar. I'm Executive Director for the Support Fibromyalgia Network. We're a patient-led nonprofit organization focused on patient medical education, advocacy, and research. And I'm also a board-certified functional medicine health coach. I'm glad I can say that in the morning. So welcome to Community Connect. So this is where we bring you the latest news, research, advocacy updates from the lupus and fibromyalgia communities. And we collaborate together with us, Support Fibro and Looms for Lupus. So we're excited to get started on this Friday. Welcome to December. We usually have a presentation and we'll go through. We're going to do the presentation a little bit differently, but I'm excited to share this. So let's share our screen. And let's get started for our participate and news updates for the week. We'll go through each of these, but just to highlight level, it's Crohn's and Colitis Awareness Week. We're going to talk about Mental Health Monday with Looms for Lupus, Amp Up with More Than Lupus. There's a Men with Fibromyalgia research study going on right now at the University of Denver. The Lupus Initiative, we also have something from Lupus LA, and then Lupus Research Alliance. So let's get started with the presentation. It is Crohn's and Colitis Week. I just wanted to give a shout out to our friends out there. I know I struggle with indeterminate colitis. I don't know if I still have it. That was something that was put on mine. So it's important that we get to know what it's like living with other autoimmune conditions, and Crohn's and colitis is something that comes up often, especially for our men out there. Please go to your doctor. Don't disregard information and get checked. I know a lot of men who've had severe cases of Crohn's because they let it go for too long. So I just put a couple of resources up here. Own Your Crohn's from Tina. I had a chance to talk to her. And then the Crohn's and Colitis Foundation. So we'll be sharing more content on our feed, especially tweeting out. They have a lot of different resources, so please go check that out. Here is the Mental Health Monday. I'm going to let Estella and Juana take the lead on this because this is their brilliant live that they have every Monday.
So I'll go ahead and get started. So as everyone is aware, coming with the holidays, dealing with COVID-19, with lupus, fibromyalgia, and any other chronic condition, it has been a little bit difficult, to say the least. And one of the things that we decided to do is to bring in some support to your homes, to your families, to the community. And we decided to team up with a couple of amazing people to bring you Mental Health Mondays. And what Mental Health Mondays is, it's basically a series of different days, or every Monday, we're going to have different topics. We're going to have experts come give you advice on how to deal with the stress. And also we're going to be doing a workshop. So a lot of these workshops that we're doing is usually what we incorporate in our support group. We've been since day one, we knew that we wanted to do something else other than just provide the support, the emotional support. We also want to provide mental health support. So the Mental Health Mondays kicked off this last Monday with Ruth Padilla King, and she was an amazing therapist. And so from the Kaiser Educational Kaiser Permanente Educational Outreach Program. And this coming Monday, we have an amazing guest. She is Yasmin Cardona, and she's going to be leading us through art therapy in a painting form. So we're going to be painting that amazing globe there. It's all free, so you don't have to register. Just tune in on Mondays at 5 p.m. on Facebook Live.
And just remember to get the supplies that you need for the painting. And we have posted that on Facebook, and it tells you exactly what you need. Now, we are waiting to see if it would be possible to do it with either crayons or colored pencils. I'm sure that we can, but it is a painting class. Hopefully, if you don't have the painting supplies, then maybe you can probably try to do it with a crayon or colored pencils on a piece of paper.
Yes, definitely.
Oh, I didn't realize that you were going to be painting the globe. So now I make the connection. So that's the topic. Like, that's the artistry.
Yes.
So, okay.
Yes. And like Estella said, Jasmine is a teacher at Mount San Antonio Community College, actually a professor. She does a lot of the painting classes and drawing. So
she also works with disabled children. And so the painting is basically an art form of creating your expression and using your emotions and expressing them. So that's why it's so therapeutic to either draw or paint or color. So she's going to give amazing tips of why this is good for you and how you can continue to do this at home.
That's fantastic, and families can participate, and it's family friendly for everyone.
Absolutely.
Yeah. Oh, perfect, because we'll share it out to our parenting resources so everyone can get involved. I mean, it's great because you'll be continuing every Monday through the month of December.
Yes, we will. And we're excited about this because, we're all dealing with so many issues and not everyone talks about it. There's this huge health, mental health stigma. And then also with all the information that's out there, a lot of people don't have access to it because they either have to be registering to it or they don't want to give their personal information, or they need to pay for like a painting instruction class. So we're trying to do our best to help the community out as best as we can. So I'm hoping that everyone shares this. You don't have to have lupus or fibromyalgia to participate. It is free. Just tune in on Mondays at 5 p.m.
Right.
Fantastic. Thank you so much for sharing and doing this. I know people appreciated the talk that you did with Ruth. I shared it all over, and it was outside of even the chronic illness communities, but I know the parents really appreciate it. There's been a lot of conversations with their kids who are struggling a lot with mental health. So parents are confused on how to manage that. So they appreciated that conversation you had with Ruth.
Right.
Before we move further into this, why don't you share with us the Lupus LA event? Because I know that's this Saturday, correct?
Yes. So this Saturday, Lupus LA, and Lupus LA, for those of you that don't know, has been around here in the LA area for many, many years. I think it's over like 20 years. They just celebrated their 20th anniversary. And Lupus LA is an organization that supports the lupus community. They support research, they support the patients, they provide scholarships and the support group. So we have partnered with them since, I think, almost since the beginning of when we started doing our support groups. And, they are amazing. And one of the things that they're doing and that they have been doing is bringing in patient conferences to the community so caregivers, loved ones can participate. So they're going to have a virtual latest on lupus conference, virtual this Saturday at oh my gosh, at 11 a.m., I believe, at 10 a.m., I believe, sorry. And they're going to have a special guest, Dr. Daniel Wallace. He is known in the lupus community. He is one of the best doctors. You know, not everyone can see him because, you know, obviously he's super busy, but, you know, he is an amazing doctor. He's written a couple of books on lupus. So register for that. You do have to register. It is free. All you have to do is go to the Lupus LA website or any form of the social media platforms, and you can click on to register. And it's very easy to register, by the way. Just put in your name and that's it. You're registered.
That's fantastic. We'll be sure to include the links in the description when I update the description videos on all our pages. It was last year, right, that I went with you to the in-person conference. So is this like what we went to? Although it was nice to have in person, they fed us food.
Yes, they always have delicious food. And that's one of the things that, you know, I love about them. Well, not that they give me food, but the fact that they think of everything. You know, usually these conferences, you know, they have like a light continental breakfast. They have everyone sit, you know, and be part of the conversation with the experts, ask questions, you know, and then kind of mingle, get together. And it's pretty amazing to be able to do that. And it really doesn't cost the patients that can't afford it any money, and their loved ones can come along too. And it's just amazing to be able to hear, you know, what's the latest on the research that's going on. They also fund fellows, and that's one of the things that, you know, I want to highlight, and I had not highlighted as much, and it's not that highlighted anywhere. Rheumatology, we have a shortage of rheumatologists, so that's why a lot of rheumatologists, you know, it's so hard to get appointments with, and it's already difficult enough to have a chronic condition, but not be able to see your rheumatologist is even harder, right? But there's a there's not a lot of rheumatologists, and they fund fellows. They actually place fellows. So right now there's a fellow, I believe, at Children's Hospital. There's another one at just different hospitals. And it's just amazing to see that they're looking out for every aspect, you know, from research to community support, to patient scholarships, to conferences, and also funding for fellows to be able to work in the rheumatology department.
That's fantastic. I really like talking to both of you because of your relationships with the other organizations and collectively trying to figure out what the community really needs. So it's nice to hear about Lupus LA. We've included Lupus Research Alliance in this presentation, and how you work with, like you just did a presentation on the Lupus Initiative with ACR. So it's nice to hear how the lupus community collaborates. And I hope people out there in our fibromyalgia community can get some ideas of how things are working in other communities effectively, so we can transfer that over to fibromyalgia.
Just call us and we'll tell you this is how it's done. Melissa from Support Fibro and us from Looms for Lupus collaborating, and it's just amazing. I think all we have to do is, you know, kind of remember where we were at from the beginning and why we're doing this and what our purpose is. And if we really look into what the purpose is, then the collaboration is, you know, what kind of it gets inspired, you know, when you look at that. So again, thank you, Melissa. You know, I love working with you. I love working with all these other organizations, and I wish there was more collaboration.
Right.
Well, it's a good reminder that people keep it patient-centric, because again, we're really working to help the patient community, like in different levels. In the end, it's like, how do you create a better life for the patient community? And if people can realize we're all on the same goal and the same page, we may just have different strengths, then we can all come together and work together.
And you're right with that, Melissa, that I mean, each organization has their strength, and if we all come together, all of our strength is going to go towards the patients, and that's what's important. That's why the collaboration is so important, because the patient need all the resources that they can get.
Perfect. Well, now moving on to even more patient collaboration here. We are, shout out to More Than Lupus, who has organized this AMP Up event. to have speakers and guests. So AMP UP is Autoimmune and Musculoskeletal Patients Unite for a Purpose. There, I wrote it down so I could read it and get it right. So we have special advocates guests. We're on there, so it was nice. This is part of a More Than Lupus event, December 12th. It'll be streamed live on Facebook. It's a free event, so participation is encouraged. We're going to be talking about health equity, community, bringing a community together, mental health. So I'm excited to be a part of it. I appreciate Kelly for the invitation. So please tune in for that. Okay, where did I go? Okay, so I added in fibromyalgia research. So this was something I just stuffed it in before we get into the other research aspects from the Lupus Research Alliance. But I was excited to hear about the University of Denver. They reached out to Support Fibro about sharing a new research study for men with fibromyalgia, and really encouraging our men to participate this. They've had in the past some low turnout. So maybe that's even a discussion to have in the future with our friends at Looms for Lupus on how we can encourage patients to participate more in these research opportunities. I know you talk about a lot with clinical trials, but this research is really important. And I think when I've talked to researchers, I've been doing a lot of outreach lately, because I want to launch something in 2021 strictly on fibromyalgia research, but there have a low turnout and low response to these surveys or participation. I know I posted this from the University of Alabama, Birmingham, with Dr. Jared Younger's group. So that specifically is a brain health study going into the lab to have your brain viewed. So that takes more time, but I definitely wanted to include that because there is fibromyalgia research out there. So if you're interested, please reach out to us and we'll be happy to send you the info. I did include this, so I'll let Looms for Lupus take the lead on the Lupus Research Alliance. It's another organization they work with, and they do research for lupus.
Yes, and I'll take this one. So, you guys probably, get confused sometimes because you're thinking, why is she posting so much about so many different lupus organizations? Not only do we obviously promote our resources, but again, collaboration is key. So the Lupus Research Alliance is another lupus organization. It's a national organization that actually raises funds specifically for research. So this means 100% of every dollar. So not 2 cents of the dollar, not 3 cents, but the whole dollar goes 100% goes to research. And why is this important? Because a lot of the overhead, or all their overhead, is covered by their board members. So that's important to know when you're donating, you're making donations, to know where the money goes. So they're very transparent when it comes to that. And every year and every time, they are always trying to utilize this money, obviously, for lupus research. So they just announced the recipients for the 2020, the funds that they received, and it was given to Dr. Marcus Clark from the University of Chicago. They're going to be working on inflammation and kidneys, and so it's really, really good. So they're going to find out, and this research is basically about determining which cells cause the kidney inflammation. So a lot of you, if you guys are kind of familiar, is lupus is an autoimmune condition, so it can attack every part of your body. And if you guys are familiar with Selena Gomez, she had a kidney transplant, so lupus can affect your kidneys. So getting research done on what causes an inflammation specifically to the kidney is huge. Also, Dr. Jessica Hammerman, she is from the Benaroya Research Institute in Virginia, an amazing institute. They actually reach out to the patients and they give talks about the research that they're going. So they were able to get funding for to research more on a IgA antibody that's really found in lupus patients. So they're looking into kind of like the impact of that antibody. So that's amazing. And shout out to our friends over at Benaroya. They did a study on lupus and sun sensitivity, and they also posted a blog and included my sister and her story. Dr. Alessandra B. Pernis, also from the Hospital for Special Surgery, which is HSS, and they're going to be researching on the type of B cells that cause tissue damage and ways that it could help. So again, another amazing hospital that does a lot of support, not only for the lupus community, but for the research as well. Dr. Greg J. Silverman from New York University, from Grossman School of Medicine, they're going to be working on about altering the microbiome in the lupus patient. So I know this is a word and a term that you always use, Melissa. So I said it right. I'm sure you're proud of me. So they're also going to be, funded for this research. And then Dr. Roger Brian Sutton, and he's from the Texas Tech University of Health Sciences Center. And they're going to be looking at replacing an enzyme that doesn't work well in lupus. So again, when you're looking at why do we work with these and collaborate with these organizations, each one has their own unique forte or strength or what they do. And research is very, very important. So a lot of the advocacy that we do when we go to Washington, D.C. with Lupus Research Alliance is we share our story. Well, my sister shares her story. I share it as a patient caregiver's perspective. And we're always asking for more funding, an increase in funding from the National Institute of Health and also from the Department of Defense for lupus research. And these are the reasons why we also push to fund the research and, for the Lupus Research Alliance, because we know that 100% goes to the research. So that's the update. We're grateful and thankful. We're part of their multicultural task force. So bringing in also the diversity is a huge thing of what they have done. And, we're part of the family. So we shout out to the Lupus Research Alliance, and also shout out to our friend Molly McCabe. Yesterday, she had an amazing event. It was, they had like a wine tasting event, and they raised funds for Lupus Research Alliance. They also, and this was her idea, and it was her event, and it was so successful. I can't wait to hear all the details about it. But also, they had, a couple of weeks ago, if you guys tuned in, and that's where the picture of me is there. They had a gala. It was virtual. It was free. If for those who wanted to attend, Lady Gaga was on, Selena was on, and Selena Gomez obviously has lupus, as I mentioned before, but Lady Gaga, her aunt passed away from lupus at the age of 19. So her song Joanne, every time they play the song, I believe proceeds go to lupus research. So that's also amazing. And her dad is part of the board for Lupus Research Alliance. I know I said a lot, but the reason I tell you all this is because I want you to remember. And if I say Lady Gaga, you're going to remember. If I say Selena Gomez, you're going to remember. If I just say that we work with them, you might not remember unless you see my picture with Lupus Research Alliance on there. But shout out to Molly and to the Lupus Research Alliance team. And thank you for all that you do.
Yeah, it was good to see the grant recipients on the website. So when I was looking, they have it laid out. It's very easy to read, and I can see how people can get invested with this organization, especially if you're interested in research. Because these particular recipients that you mentioned were from the Lupus Mechanism and Targets Awards, but they have other grants available, which I noticed were on the website. So it's just good to see all the resources that they provide. And I know that you do advocacy work with them when you go to DC. So we included them here. Shout out to the Lupus Research Alliance. I had fun at the virtual gala event. So I registered and it was a part of it. It was good.
That's awesome.
So I appreciate that. And then next up, I know you both did a full presentation for the Lupus Initiative. Why don't you briefly share a little bit about it, but then we'll defer people to your full video that you did on your Facebook and Twitter page.
Sister, tell us a little bit. Otherwise, I'll do all the talking. You know how I am. Take over.
The Lupus Initiative, is,
Oh, it's
I'm
okay.
like
I'll help you out.
totally not all here. But yeah, the Lupus Initiative has a website where you can go and you can get a lot of resources and information about how to take care of yourself, how to take control of your health, and take charge of your lupus. So you do get a lot of information. You get, of course, the description of the different types of lupus, but also how to taking care of yourself, which is very important. And that's one of the reasons that we, like Estella had said and mentioned before, that we collaborate with different organizations, because we want to bring all these resources and information to our community. All this information is there. We just need to bring it to light so that others can also learn and read about, the resources and how we can get the help and not have to go outside or not have to drive anywhere. But now from home, you can get all these resources and learn all these tips and techniques that will help you.
Wonderful. And you both did a recent live on Wednesday with all the information. You went through their website talking about all their self-care management tools. So to everyone out there, please go check it out. This is from ACR, correct? So the American College of Rheumatology has organized this?
Correct.
Yes, and they created the Lupus Initiative specifically to target the lupus community, anyone living with lupus or lupus nephritis. So they have, different videos, but again, go look at our video. We kind of went over the website just so you can know how to navigate it. And, from videos to the tips, the PDFs, it's pretty amazing to see how much the effort that they put in this. And because we know that, self-empowerment is key when it comes to living with a chronic illness.
And there's a lot of documents that you can also print so that you can have with you. If you prefer not to be reading from the computer, you can always print out a lot of these pamphlets, and you can have them with you at all times.
Fantastic. Well, I wanted to stay on the topic of research because I want to have a round table of sorts eventually, but this question goes out to everyone here and then also out there in social media land is, what kind of research would you like to see for either lupus, fibromyalgia, or what intrigues you? I want to spark some creativity and interest in science with our community. Estella, do you have some research that you would like to see?
I actually, to be honest with you, just recently I read, and I don't know if I shared with you, I might have shared with you guys, I was so excited to see research about, how long it takes for a lupus patient to get diagnosed. And in the past, it takes about 6 years. And by the time someone gets diagnosed, it might be even too late. They might die without having the diagnosis of lupus. But one of the things that really, really struck me was now that number has decreased. So now approximately it takes 2 years to get a lupus diagnosis. And I think a lot of the information that has been put out there, the fact that patients or people are empowered to now document their symptoms, helps them a lot. And all the advocacy and self-empowerment has helped. But the one thing that kind of triggered me, and if not everyone knows here, I live with fibromyalgia, and it took me a long time to get diagnosed with fibromyalgia. And on this study that I had read, it said that a lot of lupus patients that first get diagnosed with fibromyalgia, it takes them up to 7 years to get a lupus diagnosis. So I would love to see research when it comes to diagnosing and figuring out what is triggering fibromyalgia, because like I said, I think there's a lot of hope right now in the lupus community for the lupus. The Department of Defense has specific funding for lupus. The NIH has huge amounts of money for lupus, which is great and amazing. And the fact that all these celebrities help raise funds. But I think one of the things that I would love to see is fibromyalgia research. And my daughter lives with fibromyalgia. She was diagnosed as a teenager. Research when it comes to fibromyalgia, how it could get diagnosed, maybe proper, documentation of it. Also, more research on the brain connection with fibromyalgia. I have a lot of fibro fog. My daughter deals with migraines. I deal with a lot of like pressure headaches, which also are considered migraines. I just don't like to call them that. I guess it just helps me to say that they're headaches. But, just more research when it comes to fibromyalgia. I think it is much needed. We need it in our communities. We need it for us. We need it for everyone. A lot of us live with this. It's not just the pain, the fatigue, the hair loss. Like, we have so many issues and these flare-ups. So we need research with fibromyalgia. I said all that to say that we need more research for fibromyalgia and the brain connection and how we can help ourselves.
Well, I agree with you 100%. Juana, do you have some research you would like to see?
Well, like Estela said, the earlier diagnosis, not only of fibromyalgia, but also for lupus. Unfortunately, a lot of the lupus patients, when they find out that they have lupus, is already, I don't want to say too late, but late in that organs have been damaged already. And so I think that I would like to see research on earlier diagnosis of fibro and lupus, of course. And basically, I think that that's one of the things that I think that if we were to find an early diagnosis, that it would help for many people not to get the organ damage.
It's really interesting you bring that up because it goes, again, like you mentioned, to earlier diagnosis, but what Estela referenced too is that it's the 7-year buildup to a lupus diagnosis if you have fibromyalgia. So what damage is going on to the organs that people are missing in that process? If that's 7 years, that's a long time. And that's an incredible amount of damage that could be happening but that's what happens. You're in between autoimmune and come back when you're full blown, but we got to catch it earlier and figure it out, and also not disregard a lot of the symptoms as just fibromyalgia. So we got to go deeper. So,
right.
And both of you know I love research. So
yes, we need you to get some experts here with you so you could, kind of give them the ideas of all this brain, connection with fibromyalgia and how it impacts our daily lives, again, focusing on all the damage that this has caused. Fibromyalgia is seen just as a syndrome at times, or just, not something that will damage your organs. So it's like, oh, you have fibromyalgia. Okay, keep on living. Okay. Oh, you have lupus. Let's figure out how we can help all your organs and stop these flare-ups. And meanwhile, you have all this possible damage, I'm sure there's a huge connection, and I wish and I hope that researchers are out there listening to this, and then we have that, they include us and we have these types of conversations. I was on 2 webinars yesterday, or 2 conferences, and one of them was with researchers and including the patient's voice and including the patients and the caregivers. But I was kind of disappointed, I should say that. I was eager to be on there because I was asking questions, and I just asked one simple question. And I won't even say what pharmaceutical companies were on there doing the research and stuff, because I won't out them here. But all I asked was a simple thing about what are we doing to include, one, diversity, right? 17% of the US population are Hispanic or Latino. 1% participate in research. That was my question. It was an easy question. What are you doing? And they didn't even look at the question. They had time because they skipped over my question to go to the following question, because you can see the order of the questions. And it was so disappointing, because all they had to do was say, we are looking into how we can reach to the community. And for any researchers that are out there, what you need to do is connect with patient-led organizations like us, grassroots organizations, and here we are, that are in the community, that can tell you as patients, as caregivers, what we need. Because most of the time, researchers are doing their research, and we are grateful for it. but you need to come out of that box, the research box, and find out what is going around in the community, what is needed. So this is an awesome question. Melissa, what kind of research would you like to see? Now I ask to the researchers, what kind of participation would you like? Oh, wait, you can't do research without the patients, right? So maybe include the patients in the discussion and preparation for future research studies.
Absolutely agree. And that's one of the things that we are doing. We bring in that awareness, and not only the awareness to our community and patients, caregivers, but also we need to bring awareness to our researchers to understand that they need the patient to do the research, and they need to include everyone, because I mean, we all need to be included. We're all different. So definitely. And to find any individualized or precision medicine, we need to have the diversity. And definitely. So we do need to bring, I guess, more awareness also to the researchers to understand that they need the patient and the diversity.
Oh yeah, I would love to be a part of the NIH budget for fibromyalgia, like being in charge of allocation. So anyone needs an intern out there, I volunteer my time right now and saying that out loud. Because I have so many ideas, because it's just with fibromyalgia itself, are we looking at genetic components like ApoE4 variant? Do people know what that is in our community? Blood-brain barrier, permeability, microglial activation, like all that stuff involved with all of that. Nutrition, we don't even have any nutrition stuff for fibromyalgia like we should. So it's all involved, because I think if you talk to a patient too, and I'm not trying to knock exercise studies at all, all the research is important, but if you talk to a patient about exercise and fibromyalgia, you'll realize something there that needs to get addressed, and how maybe we need to be looking at other things besides the treatment only option of telling people to exercise, and what that looks like and how it affects other systems. But neuroinflammation, we need to expand on that. So I do agree, patients need to be involved. And I think that's one thing we're going to try for 2021 is been doing more outreach to researchers, have these conversations. Hopefully they're okay with having conversations with patient-led organizations, because we're just gonna be out there and introduce ourselves and just start the conversation. We need to, because we also need to connect. They're looking for patients to get involved in their research. So I know, like I mentioned earlier, that fibromyalgia has a low response. Like they don't respond as well to this stuff. So how can we increase that response? And I think there's a disconnect there that we need to discuss.
Definitely.
So I'm like, and if anyone out there, if you have ideas like I do, you're sleeping and you're thinking about it, like, why don't they research this? Please share in the comments. If you're rewatching the replay, please share in the comments, send us messages. Be happy to hear from you. And of course, if you are a researcher, please get in touch with us. We want to have these conversations.
If we didn't scare you, hopefully we didn't. Hopefully it sparked an interest.
I hope I don't scare them, but I understand that I can talk about science all day long. So we appreciate the research everyone's doing. So even if someone has a hypothesis that they're like, want to try or talk about, I think we can give them a forum too with what we do with the lives, and bring in researchers and humanize the research more, and to have these open discussions with them. It's really important, because we need the research in order to affect the treatments, to translate to the providers. So it's a whole chain of events that needs to happen. And I think especially with fibromyalgia, there's a huge disconnect. Looks like with lupus, they've connected these dots and they've worked on that. So it's great.
Yes. And, and I think you brought in a very good point. It's the connection, you connect, you hear everywhere, you want patient-centric care, and that's what the providers are delivering. You can't do that if the patient is not part of your care team. Then the same goes with the researchers. You can't do this without the patient, and trust, building that trust is huge. So I think if you humanize it, like you just said, Melissa, it is going to help out so much. And also, us as patients, we are the experts in our bodies. We are the experts in the diseases that we have when it comes to our bodies and our experience. So it's very important to also acknowledge that we're not just, patients that are going to be complaining. We want to work. And you have here, like you, Melissa, you've been living with fibromyalgia since the age of 14. You know a lot of the scientific terms and all the science behind the stuff that you would like researched. And I wish that some researchers would listen to some of the patients, because some of us are pretty knowledgeable. And by us, I mean Melissa.
No, you guys are all knowledgeable. That's what I mean, it's definitely that's a big point even for provider conferences. Please don't discount that we actually understand information. We live for this so long that we get it. I mean, we know a lot of people understand lab values. A lot of people track their lab values. We understand terminology. So it'd be nice to be more included and not, separate. You got to do only patients over here, providers here, researchers separate, like nobody talking to each other, because it's like we don't want to touch each other, be in contact with each other.
Yes, and then here's another interesting part. And I was at another at Stanford or MedX conference also yesterday, and one of the things that I heard was about translational medicine, and how so you have these researchers, you have these new treatments coming out. Who knows about them first? The patient, because we're part of the studies. We know if treatments are coming out, we're excited about it, we read about it. Then we go to our doctors and we're like, hey, we're amped up. Can I get this treatment? And either the doctor that you go to doesn't know about the new groundbreaking treatment. One, they don't have the information to give you, and you only have like 15 minutes to go over your list of issues, and there's no time for that discussion. So there's a huge gap, not a little gap, a huge gap that we're missing. And I think us as patients, we may be that connection, and we may be able to help fill that gap. So that is huge. So please involve us. We could be the connectors. We need to educate providers. We need to work together with researchers and work together with our providers and our healthcare team.
Well, and I noticed that gap, which is where I kind of inched forward. I debated on myself when I got my health back was to go maybe to naturopathic school or become a doctor. It was going to take too long, and I have a lot of impatience because things need to get done now. So my thought process for becoming a health coach was to start bridging this. So now I've moved from complete patient. I'm still a patient, but now I'm like allied professional. And I mean, there's different people that work in this spaces. So even collectively bringing our allied professionals. I know you work in healthcare, Estella, so does Juana. So how do we bring this experience to the table and make sure people know, I'm like, hey, we have experience behind us as well. When we're having these conversations, we understand the healthcare system already, so we don't have to be educated or displaced on that as well.
Yes, definitely. And I think educating and working together, and your program, which I don't want to give too much about what you want to do, but this whole ECHO project really gears towards that. And I think if providers are willing to learn about these conditions from a patient's perspective, I think it would be greatly appreciated, not just when it comes to other patients coming in to get treatments from them, but also the collaboration. You're a functional medicine coach. The connection between that provider or the rheumatologist or the primary care provider with you as an allied provider is beneficial, because you can't just get better with a 10-minute, 15-minute consult, right? And so there's part of responsibility that comes to us as patients, responsibility that goes to the provider, but then we could also share this responsibility and or guidance from people like you, functional medicine, health coaching, and how we can incorporate that in helping us besides all these other self-empowerment tools that we have. And I think, you doing this for the community is huge. And I would love to see just one focused live chat where we bring your expertise as a functional medicine health coach to us, the fibromyalgia, the lupus community, and the overlapping conditions like rheumatoid arthritis, et cetera, because, again, a lot of people don't know what a functional medicine health coach does. They don't understand how they can help, what you can do for us. And I think it's huge that you're doing this. And I just, I want to hopefully share this with the community if we get to set this up so you can share
Yeah,
that.
I mean, that'd be great to give an overview. I mean, a big thing too is when you talked about the lupus initiative, the self-care management tools, they give you all these tools, and for people who find it overwhelming, so when they start downloading and implementing it, it's like, this is where health coaching can come in, because we meet the patients where they're at and help set these smart goals, tangible goals that they can actually meet, because sometimes you're maybe shooting over here, you're trying things that are too big that you might not be ready for, and you forget that there's all these other steps. It's like, you can't start yoga right away. I mean, there may be other variables in between, like you might need to purchase a yoga mat. You might need to do research on different types of yoga. So like, that's a lot, because people just start something, or they're going to start running, right? And they start running and and then you crash and you don't ever want to do it again. So it's all of these things with brainstorming, but meeting patients where they're at and helping them through a lot of those self-care tools. And it's important.
And I think that you just hit the key there. We need someone to help us through this process. A lot of people just go, they get their diagnosis. If they're like me, I had already researched, I had a lot of support, but not everyone has that support. And it is very, very important to, if you do not have the support, to know what your options are. And, not once have I gone to a doctor's appointment where they tell me, hey, you know what? You can go to this support group or this organization, or you know what? You can go to a functional health medicine coach and they can help you, guide you if you're, if you're willing to do this. They basically tell you, okay, so you have a diagnosis of lupus or fibromyalgia or whatever it is, and here's a brochure. And sometimes you might get a brochure, you might not. Sometimes you might even get a plan at the end of your visit. Sometimes you may not. Sometimes you may walk out without even medication, and sometimes you may. So it's like, give us some sort of guidance, or if you're not going to give it to us, at least provide the resources. So, it's just, I feel like it's just, I don't know, maybe I'm just now rambling, because it's just frustrating to me to see that, there's still so many gaps. And I'm just grateful that you're trying to fill all this gap, getting the research, talking about the health literacy, talking about the research topics for research, how functional medicine can help, just collaboration, just advocacy, everything. I think all of this is pretty amazing, so I'm just grateful for you, Melissa, for bringing all this up. And you make us all look very smart when you start talking about, all these connections and the importance of it. So.
Well, and we're going to build the ECHO model together. So we're going to incorporate all the services that you do. So that touches upon what you talked about. So these referrals, because you really want to build a community with your providers. Because I think when they go and they're just getting these, sometimes it's just flat. Like, it feels flat when they go to a website just to get CMEs, but it's not translated to the patients. Or again, it's like, where do they go? And so we're connecting the dots and really building the community for providers, because again, they're not our enemies. And this is what we have to work together. So we really need our providers to feel invited to the community, bring our researchers into the community where we're all working cohesively together and sharing the information. So we'll provide those researches, we'll provide resources to providers. So what are the support groups, the art therapy groups that they can go into, health coaching, who are some of the allied professionals that maybe they don't think about, community health workers, social workers. especially when people are managing a disability and, struggling with those things. We have to bring mental health professionals. Yes, that's a big one too. So it's a lot of work, but we're excited and we get to work together. So yes, there's a lot in my head. And if I'm not talking about MTHFR and ApoE4 variants, we'll work on this stuff.
Yeah, so all they have to do is watch this, and then they'll know, that we kind of know what's going on, and we may be able to provide solutions and or help, fill these gaps. So
we will be able to provide solutions. We are a determined group. We know we've lived with this for a long time. We know on the ground floor, and I think it's definitely time to fill those gaps and start. So we definitely have this. It's been great. So learning from the both of you and all your work.
yeah, and we have to continue. I'll just say our little slogan, you never give in, never give up, never let go, just keep fighting. And that's what we will continue to do. Just keep fighting for research, keep fighting for better resources, keep fighting for the patient's voice, keep fighting for that seat at the table, keep fighting for our communities, whether it's with mental health, whether it's with chronic conditions, with fibromyalgia, with lupus. We are in this together, and I just wish that everyone was in this together for the right reasons.
Right. And of course, never to give up, and never to give up as a patient, and not giving up in what we're doing, because we really do want to see a difference.
Perfect. Before we close out, okay, Mike is making me laugh. Funny story before we close out.
Yes.
So we were doing an inflammation video on microglial, and I forget, he wanted to know, he's like, who's Michael Glial? And I was like, I busted out laughing. I don't laugh that hard very often, but that's when he posted a comment. One day everyone will know about Michael Glial. So that's an inside joke on, because I said microglial. He's like, who's that? What's his name? How do you spell his name? I was like, how do I spell whose name? I was like, oh. So nerd inside joke in the nerd central with Michael and I. So before we close it out, just shout out to everyone out there. Thank you for supporting both of our organizations on Giving Tuesday. We appreciate it. We are patient-led nonprofit organizations who do a lot of work on the ground floor directly with patients. So all this giving is very important. I know like Syndio Health donated to Looms for Lupus. You guys had a campaign going. We had a Giving Tuesday campaign. We're selling chocolates. So to raise
I got my chocolate.
So we appreciate the community supporting our organizations out there. It's super important running nonprofits on, doing this as a passion of ours. So anything that you give is very appreciative, even your time and your energy and just sharing. I know not everyone can give monetarily. This is such a difficult year, but if you could like our pages, share our content, and just let other patients know that these resources are available and we have the resources for them. Join the Looms for Lupus support group, join their conversations with art therapy. That helps too. So, and then you get a benefit back.
Right.
Any closing remarks from Juana or Estella?
Just thank you to everyone as well for supporting Giving Tuesday, for supporting us, and for continuing to share our content.
Right. And I want to thank everyone and also remind everyone about the Mental Health Mondays. Join us. It's free. Like we mentioned earlier, it's free. You're welcome. And everyone in your family, friends, and even children are welcome to participate and see what we're going to be doing for our mental health.
Yeah, please join the Mental Health Monday with Looms for Lupus. It's important. Share with your friends those videos. Have them join. It's not just for the chronic illness community. Share wide to all your family, friends, your loved ones, and caregivers.
Right.
And just in case you missed it, Melissa is a biohacker.
So, Yeah, I got to work with my Brandy and the poster biohacking. So eventually we'll return to the purple hair, but right now it's not. Thank you, everyone. Have a great weekend and tune in to Looms for Lupus page on Monday. So that's actually Lupus LA tomorrow.
Yes.
And then Looms for Lupus on Monday for Mental Health Monday.
Right.
Okay. Bye, everyone. Thank you.
Bye.
Bye.